Hey y'all, my name's Justine, and I'm going to be talking to you about multiple sclerosis. This hits home for me because a woman that is really good friends with my dad, and I consider like an aunt, developed MS and was no longer able to drag race. It is her dream that there'll be a form of medication or some kind of treatment that is developed so that she'll be able to drag race again. I hope you all enjoy and learn something. So what exactly is multiple sclerosis, more commonly known as MS? The National Multiple Sclerosis Society defines it as involving an immune-mediated process to which an abnormal response of the body's immune system is directed against the central nervous system. The central nervous system includes the brain and spinal cord. The following are important facts about multiple sclerosis. It is a potentially disabling disease. And to further expand off the definition, MS disrupts the flow of information within the brain and between the brain and body, referring to the numerous scars that develop on the white matter of the brain. It is considered an autoimmune disease. Within the central nervous system, the disease destroys the protective sheath called myelin that covers the nerve fibers. Eventually, the disease destroys the nerves themselves. Compared with other chronic conditions, MS ranks second in terms of costliness. Number 1 is congestive heart failure. Possibly the most important fact about MS is that the cause is unknown. It is also not a reportable disease, meaning the government doesn't require physicians to inform any central database. There are 5 basic risk factors: age, gender, family history, race, and climate. If you are between the ages of 15 and 60, you are more likely to get MS. Women are twice as likely as men to be diagnosed. If one parent or sibling has MS, you are of higher risk. White people are higher risk than Asian and African or Native American. MS is more common in countries with temperate climates. Basically, the farther you are away from the equator, the more at risk you are. Possible other factors are smoking, which enhances the disease progression. Obesity in childhood or adolescence increases the risk of developing MS, and vitamin D deficiency. The low levels in the blood have been identified as a risk. Although multiple sclerosis is not a reportable disease and statistics are not 100% accurate, there is still some data collected by individual agencies. MS has affected 2.5 million people in the world. 400,000 of those people are in the United States. There are 200 new cases diagnosed each week in the United States. The direct and indirect costs per patient each year in the United States is between $8,528 and $54,244. In 2015, there were 18,900 people who passed that had been diagnosed with some form of multiple sclerosis. If any of the previous risk factors apply to you or someone you know, be aware of the symptoms associated with the disease. Those symptoms include numbness and weakness in one or more limbs that occur on one side of your body at a time, partial or complete loss of vision, prolonged double vision, tingling or pain in parts of the body, electric shock sensations that occur with certain neck movements and tremor, lack of coordination, or an unsteady gait. Symptoms that you should still be concerned with but are less severe are slurred speech, fatigue, dizziness, problems with bowel and bladder function. Now, let's take time to pause the video for an activity. Open a new window and go to the link provided. While completing the brain games, think about how someone with MS might benefit from them. Also, once you've completed the brain games, see how you compare with others in the United States in your age group. There are 4 types of multiple sclerosis: clinical isolated syndrome, or CIS, relapsing remitting MS, or RRMS, secondary progressive MS, or SPMS, and primary progressive MS, or PPMS. CIS is the first episode of the neurological symptoms caused by inflammation and demyelination. It usually lasts for 24 hours. When diagnosed, and it is accompanied by lesions on the brain found in an MRI, there is a high likelihood of a second episode. CIS is 2 to 3 times more likely in women. 70% of individuals diagnosed are between the ages of 20 and 40. RRMS is the most common. 85% of people are originally diagnosed with MS have RRMS. There are clearly defined attacks with new or increasing neurological symptoms. It is characterized by active, not active, worsening, and not worsening. Active means they are having relapses and one or new evidence on an MRI. So basically, there are more lesions on their brain. Worsening means there is a confirmed increase in disability over a specified period of time following a relapse. SPMS is the second most common. 50% of diagnosed cases are SPMS. It follows the initial RRMS. Most individuals who have been diagnosed with MS will eventually transition to SPMS, characterized by active, not active, with progression, and without progression. PPMS is the least common. Approximately 10 to 15% of people with MS are diagnosed with PPMS. Those diagnosed with PPMS have worsening neurological function from the onset of symptoms. It too is characterized by active, not active, with progression, and without progression. Tools used to diagnose MS are neuroimaging, blood tests, cerebrospinal fluid analysis, MRI, family medical history, and evoked potential studies. Treatment options consist mostly of medication and natural or alternative options. There are 12 disease-modifying medications listed on the next slide. Unfortunately, there are no treatments available for nerve damage. Natural and alternative treatments include manual healing, mind-body connection, movement therapies, natural healing, environmental healing, psychological therapies, and alternative health systems. Rehabilitation is also an option. The complications associated with MS are muscle stiffness or spasms, paralysis, which typically occurs in the legs, problems with bladder, bowel, or sex function, mental changes, forgetfulness or mood swings, depression, and epilepsy. Assisting someone with multiple sclerosis can be difficult. Most of the time you won't know if or when they will relapse. However, studies have shown that strength training can help with MS patients. It builds strength and mobility in their body. MS patients are typically able to lift and do more after completing a 12-week training program. Other activities that are good for individuals with MS are cycling, aquatic activities, golf, and monoskiing. Cycling can be done with tandem bikes or hand cycles. Golf has accessories specifically for individuals with disabilities like MS. They have gloves with extra grip and clubs or other devices to help pick up balls. Monoskiing is when riders slide down the slope in a bucket-style seat using ski crutches to glide through the snow. And for our final activity, take time to pause the video and go to the link. Read an article. There are plenty to choose from. Each case resulted in an MS diagnosis. Answer the questions through the CME located at the bottom of the page. These are the resources I used when creating this presentation. I hope you guys enjoyed.